Let's dive into the real cost of Australian healthcare, and it might not be what you think.
Have you ever put off seeing a doctor because of the cost? Well, you're not the only one.
And it's these small, personal decisions that are quietly adding up to a massive national crisis. This crisis doesn't look like some big, flashy headline. It's much quieter than that. It's found in those tough, private choices families are forced to make when budgets are squeezed. And now, the cost of living crisis is just pouring fuel on a fire that's been burning for years. It's basically a perfect storm: rising costs for clinics and huge financial pressure on patients. This creates what economists call the sustainability gap, and it's right at the heart of the problem. And this gap, it directly answers a big question. Why is it so hard to find bulk billing anymore? I mean, just look at the numbers. With rising costs, clinics can actually lose money on a visit.
And believe it or not, for services like psychology, that gap gets even wider.
Yeah, a gap that big is often the difference between getting care and having to go without. So, what happens when millions of people delay care? You get a massive ripple effect. Think packed emergency rooms, people getting sicker, and doctors burning out. It's a domino effect. And this is the crazy part. Skipping a small GP bill now leads to a massive hospital bill later.
What this all leads to is a growing divide, a two-tier system based on what you can afford.
All right, so where is all this headed? If nothing changes, the system is going to look different. We'll probably see more telehealth, but also more pressure on community health services to pick up the slack. But look, these are just workarounds. They don't actually fix that core funding problem.
So no, the system isn't collapsing. It's just slowly becoming less fair and harder to access for everyone.
And that's the whole point. This crisis is hidden because it's made up of millions of our own private choices. Which leaves us with a pretty big question. What's the final cost when these choices reshape healthcare for all of us?